Good evening from New York. I'm Chris Hayes. The president may not have been exonerated by Robert Mueller. In fact, he explicitly wasn't, but he sure is acting like it. 2 days after the release of a 4-page letter from Trump's hand-picked Attorney General, William Barr, selectively quoting a Mueller report that almost no one has actually seen, which Trump falsely claimed amounted to a, quote, total exoneration, the president is now adding a flourish to his victory lap. He has instructed that hand-picked Attorney General to do just about the most destructive thing possible. Move to strip health care coverage from more than 20 million Americans and throw the entire health care system in this country into utter and immediate chaos. Trump's Justice Department filing a brief letter indicating it now agrees with a December ruling by far-right District Judge Reed O'Connor striking down the entirety of Obamacare in response to a lawsuit from a group of conservative attorneys general. Now, that ruling, the original ruling in district court, was seen across partisan and ideological spectrum as very far outside the legal mainstream. So far outside the mainstream that even the Trump administration itself did not initially support it. But now, just like that, they do, setting up a legal battle that is expected to reach the Supreme Court. And here's what it would mean if Trump gets his way and Obamacare is struck down, as the Department of Justice is now calling for officially. More than 20 million people covered through the Medicaid expansion and the exchanges will be stripped of their coverage, taken away. There will no longer be protections for people with pre-existing conditions. And a healthcare system that has changed dramatically in the 9 years that Obamacare has been law will be thrown into chaos. It would have hugely dire consequences for tens of millions of people, even those not covered by Obamacare. The health insurance industry says the government's position puts coverage at risk for more than 100 million Americans. Those are the real-world implications of this move. And then there are the political repercussions. Democrats won big in 2018 by running in large part and primarily on health care. Polls show a clear majority of Americans want Obamacare to remain law and overwhelmingly oppose eliminating protections for people with pre-existing conditions. In fact, just this morning, Democrats unveiled a new bill to strengthen protections for those with pre-existing conditions while lowering premiums, and they took the opportunity to spotlight the difference between the two parties.
The GOP will never stop trying to destroy the affordable health care of America's families. In this House, with a Democratic majority, we're here to strengthen those protections and to lower health care costs further. Because this House, this Democratic House, is for the people.
9 years after Obamacare became law, Republicans still have yet to produce a workable Obamacare replacement bill. When they've promised for so long. What they have done is develop a new strategy, which is to lie to people's faces, to insist they actually support, for instance, protecting people with pre-existing conditions while actively working to destroy them, and to make meaningless pronouncements like the Republican Party will magically become the party of health care. No explanation needed.
There's an inconsistency, if not an hypocrisy, here. Why would you mislead the American people that way? Why would you say you support the benefit of a pre-existing condition when you voted to eliminate it and now overwhelmingly are part of a lawsuit to eliminate it and support an administration who wants to do away with the whole bill?
Joining me now with his reaction, Vermont Independent Senator and 2020 Democratic presidential candidate Bernie Sanders. Senator, surprised at all by the move by the White House to do this and/or the timing?
Nope, not surprised at all. Nothing Trump and his friends do surprises me. The idea, however, that they would ask the courts to say that the Affordable Care Act is unconstitutional and throw up to 30 million people off of the health insurance they have, do away with the protections we have for pre-existing conditions, do away with the fact that young people 26 or younger can have the insurance that their parents have, raise drug prices for seniors. No, I mean, it's an outrage, but we've seen this movie before.
Do you think, I mean, one of the things that's always been bizarre here and sort of maddening about this is the president said he was for universal health care, it was going to be great health care and cheaper and everyone was going to get it. People really believed him. If you looked at the polling, you talked to people at the campaign trail, he's at it again today. Do you think that message sells or do people see through it?
Well, I'm going to do everything that I can to tell the American people, including the many people who voted for Trump, that he is an absolute fraud, as you've just indicated. He talked in his campaign about health care for everybody and then supported legislation that would throw over 30 million people off the health care that they have. So we have got to expose him for what he is, and we have got to talk about where we should be going as a country. I don't know, Chris, how many Americans know that we're the only major country on earth not to guarantee health care to all people, that we spend almost twice as much per capita on health care as do the people of other nations, that our health care outcomes in terms of life expectancy are not as good as many other countries, that the cost of prescription drugs in this country is far, far higher than any other nation on earth. That's the message we've got to take to the American people. The function of health care is quality care for all, not to make billions in profits for the insurance companies and the drug companies.
Okay, so you talked about where we should go, so I want to talk about that now. The Democrats introduced legislation in the House today that is focused on some reforms and modifications to Obamacare, particularly people who are in the exchanges who have very high premiums. Do you support the legislation the House produced today?
No, I support the Medicare for All single-payer program. Look,
wait, I just want to be clear. So you don't support that incremental reform?
No. The incremental reform that I support is phasing in Medicare for all. First year, we would lower the eligibility age for Medicare from 65 to 55 and cover all of the children. And by the way, expand Medicare coverage for elderly people to include dental care, eyeglasses, and hearing aids. That's the incremental 4-year program that I wrote and that I support.
Right, but I just want to be clear about this. So if that House bill were to come over to the Senate, you would vote against it right now?
Look, right now we are working on what I have fought for my entire life. Health care is a right. It has to be publicly funded. It has to be comprehensive. Right. The current system, Chris, is dysfunctional. It is enormously wasteful. We spend hundreds of billions of dollars every single year on administrative costs, outrageous compensation packages for the CEOs of the insurance and drug companies. Ultimately, we have got to do what every other major country does, and that is guarantee health care to all, do it through public funding, save huge amounts of money in administrative costs. So that's Medicare for all.
Okay, so there's lots of people running on Medicare for all, but there's been some interesting sort of debate about what it means, and there's sort of two different ways that people are talking about it now. One is what you've talked about, a 4-year phase-in, you lower it and you get Medicare for all. The other is the idea of sort of a Medicare buy-in, right? So you don't say everybody's in the Medicare system, you just say everyone has the option to, you can optionally buy in at Medicare rates. That's called Medicare for America. There's a bill with that name in the House. That is polling very well right now, 51 to 30%, whereas the sort of more traditional Medicare for all that you support is even. What do you think about that as an alternative? Why not sort of slide towards the system in an optional way?
Because ultimately we have to recognize that the current system is incredibly dysfunctional and wasteful. Its goal is to make profits for the insurance companies and the drug companies. You are not going to be able, in the long run, to have cost-effective, universal health care unless you change the system, unless you get rid of the insurance companies, unless you stand up to the greed of the drug companies and lower prescription drug costs. That's the only way that you can provide quality care to all people. I look at health care, Chris, the same way as I look at public education, the same way I look at police protection, fire protection. All people get it regardless of their income. It is publicly funded. That is the most cost-effective way to provide health care to all.
So you've been very clear about that and very consistent about that through the entirety of your career. But I guess the question is about the paths to get there and what is an incremental improvement, right? So, I mean, for instance, you voted for the ACA because that was an improvement upon the status quo. Would you vote for, say, Medicare for America if that came up in the Senate?
Right now, it ain't going to come up in the Senate.
Unless Mitch McConnell wants to troll you guys like he did today with the Green New Deal, it might.
Yeah, look, you got a Republican president, Trump, and you got Republican leadership that want to throw 30 million people off of health insurance. They don't want to add anybody onto health insurance. I think we got to stay focused on, keep our eyes on the prize. And the prize is health care for all as a right, regardless of income, that we need doctors doctors to be in places where they aren't right now. We need more nurses. We need to take on the drug companies. That's what we have to do. And look, let me be very clear about it. You know, I just spoke to, I think, 35,000 people in California over the weekend at 3 different rallies. And the point that I made, Chris, is this is not going to be an easy fight.
Right.
When you have health insurance at 18% of our GDP, when we're spending about $11,000 a year, when the profits for the insurance companies and the drug companies are incredible, they are going to fight us tooth and nail. They're going to spend hundreds of millions of dollars in terms of lying about what Medicare for All is, in buying and selling politicians. They have an enormous number of lobbyists. They spend a huge amount of money on campaign contributions. This is going to be a real fight, and the only way we win it, Chris, to my mind, this is not a debate over health care. This is a political fight.
Right.
Do the American people stand up and take on these very powerful special interests, or do we not?
Although, ironically, I would say those drug companies and health insurance companies are not psyched about the idea of the Supreme Court striking down Obamacare one day and everyone waking up with the system in total disruption the next. Senator Bernie Sanders, thank you for being with me tonight.
Thank you, Chris.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.